Well, good morning. My name is Victor Dzau. I'm the president of the National Academy of Medicine. And I'm just delighted to welcome you all to this virtual public meeting of the National Academy of Medicine's Action Collaborative about decarbonizing the US health sector. Now, why do we need to do this? Well, we all know that climate change is a major issue, is an existential threat. Last month, the UN Intergovernmental Panel on Climate Change, called IPCC, issued its synthesis report for the sixth assessment report, and it declared the evidence unequivocal that human-caused emissions of carbon dioxide and other greenhouse gases are the overwhelming driver of climate change. And the report details that the rate of temperature rise in the last half century is the highest in 2,000 years, and the concentration of carbon dioxide at the very highest in at least 2 million years. These are amazing data. So we all recognize we need to take action to cut emission. But I think the reason we are here today is to say we got to do it urgently, because it's not only about the future, it's not only about our grandchildren, it's actually about all of us now, because it's affecting health and health equity. So the reason this meeting and this group working in the health sector, biomedical community, need to take action is because, number one, we are responsible, certainly in the health and wellness of the nation and globally, and with about public health and health. And I would say climate change is a public health crisis. It's also an equity crisis. Why? Because you look at the number of people who are affected, dying from climate-related issues, such as extreme weather, floods, hurricanes, drought, famine, infectious disease outbreak, vector-borne disease, and of course, globally, we are dealing with, huge number of climate refugees. And in this country, air pollution and many others, there's an urgency to act. And we, as some of the most trusted voices and messenger, that is clinicians, health leaders, have a duty to sound the alarm on the health impacts of climate change and do our part in addressing this issue. It's an equity issue because climate change affects the poor countries, the poor neighborhoods, more than the rich countries and rich neighborhood. And they have much less resource to respond to it. So it's an equity crisis. The other reason is because the US health sector alone is responsible for about 8.5% of the nation's carbon emissions. That's almost 10%. It's huge. Knowing this, it's imperative this whole sector come together, act collectively to reduce its carbon footprint and to ensure its resilience and sustainability over time. So I think that if we do it right, these efforts will translate into better care, better outcomes for patients, low cost, greater health equity, and of course, mitigate the climate change issue. So this is why we, the National Academy of Medicine, launched this Action Collaborative back in September 2021, after a year and a half, 2 years of planning. This grand challenge, we call it, on climate change and human health and equity is about taking action in this area. It's a public-private partnership. Bring together all the stakeholders to make a commitment to work together as a part of the collaborative. So I'm really pleased and really fortunate to have so many of you joining us as a collaborative, and so many of you today online trying to understand what we do. And we certainly urge you to join us because we've got to do something about this. And so it's my great pleasure to say that my co-chairs, George Barrett, the former chairman and CEO of Cardinal Health, Andrew Witty, the chief executive officer of UnitedHealth Group, and Admiral Rachel Levine, the assistant secretary of health, HHS, are all part of this leadership that work together with all of you. Now today, Admiral Levine's not able to join us this morning, although in a later meeting, she'll be joining us. So I'm going to turn over to my co-chairs, George and Andrew, for their comments. Over to you, George.
Thank you, Victor. I hope you can all hear me. Someone has just decided to mow their lawn outside my window, and so I put my earpiece in. Hopefully everybody's hearing me. Thank you all for joining us today. Much has happened since our last public meeting, and just to highlight a few, the signing of the Inflation Reduction Act, which represents an unprecedented level of funding, including incentives designed to encourage investment in accelerating our movement to a clean energy economy. And second, Victor mentioned the UN report. A recent UN report expressed that, or shows that our planet appears to be warming faster than projected by earlier models. And with that, the risks to human health, as Dr. Dzau described, the very challenges that we are committed to fighting. So our work here at the Collaborative has been progressing, and our 4 working groups have been active during these months. I'm grateful to our Collaborative members for their engagement. Each meeting is a reminder that we represent a diverse mix from public sector, academia, and the private sector. We are each at different stages in our journey to decarbonize. We bring different experiences and different perspectives, and which means at times robust debate. In the end, however, we are all animated by a common commitment to reduce our carbon footprint as a healthcare sector. And so with that, I will turn the virtual podium over to fellow co-chair Andrew Witty.
Hey, George, thank you very much. And good morning, everybody. And thanks so much for giving up some of your time to take part in these conversations. As you've heard both from Victor and from George, it's clearly a super important topic area. And maybe one additional perspective I would bring is the complexity of the stakeholder mix who have to change behavior to make an impact on carbon emission in the health sector is really pretty unprecedented if you think about it. Not only is it a complex blend of governmental, state and private actors, it also includes some of the very largest companies in the world. It certainly includes the largest hospital systems in the world, but it also includes millions of individual providers. So at one end, you have almost single-handed participants in the system. At the other, you have some of the biggest organizations in the world, whether they're government or private. That's not a trivial mix of people to try and mobilize. And one of the great benefits, I think, of this collaborative effort is at its heart to try and bring together that mix of people and figure out a pathway which can work for the sector as a whole. We're going to hear later today from a really interesting cross-section of some of those stakeholders, and I hope that in those various conversations, it will further advance the understanding that needs to be built to make sure that we're able to essentially reform the value chain that is US healthcare in a way which can be much more sustainable than it has been in the past. It's really the purpose of what we're trying to do, and hopefully will be something that from today we can give a further impetus to. With that, look forward very much to the rest of the session today, and I'll hand back to Victor to kick off with the keynote speech. Victor.
Thank you, Andrew, and thank you, George. I would like to echo both your comments and enthusiasm. The uniqueness in this collaborative is truly bring people from all sectors or subsectors within healthcare. And you need to do that together. You can't do this alone. There are indeed initiatives that's looking at one area or the other. What's unique about this is bring everybody together to say, how do we do this together? As George and Andrew said, we all have slightly different perspective at different stages. And the fact that we are actually doing it together, helping each other, and being committed together is the key to this collaborative. So let me therefore take the next 15 minutes, tell you where we are, who we are, for the public, for those who are not aware of this. The collaborative on decarbonizing the US sector. May I have the first slide? Next slide. So it is a bold initiative. It takes on this issue of climate change, human health, and equity crisis. Taken us about 2 years of planning and launched in October 2020. this whole thing called the Grand Challenge. And the Grand Challenge is chaired by G.D. Roden, the past president of Rockefeller Foundation and president emerita of Pennsylvania University. And the Grand Challenge brings together 180 some experts in different sectors to work together. So it's a true private-public collaboration. For example, we already discussed Andrew Witty, George Barrett, Secretary Admiral Levine, and the US government, the private sector, the health system, the public health, and the global economy. So truly everybody together. And of this Grand Challenge, one major feature is the collaborative decarbonization. Next slide. So the Grand Challenge as a whole program has 5 different strategic directions. One is to communicate this public health crisis, to message it, and to educate our healthcare workers the importance of working on this. Second is what we're going to focus on today, to decarbonize the US health sector. Third is to create a roadmap for all systems that affect climate and health, such as agriculture, transportation, energy, food, water, and of course, healthcare. And it's important to bring them all together with a lens of what it's doing to human health and human equity. And next is, of course, research innovation that's really needed to move forward. And finally, the cross-cutting to look at network of communities which are affected, particularly the at-risk communities, the equity issue. Next slide. So I'd like to focus on the one that we are talking about today, which is the decarbonization, one of the 5 big areas that we're working on. This is particularly exciting and one of our kind of, so we say, most active areas, because we understand to decarbonize the health sector, to do no harm, we have to have a shared action because of the many, many people involved with the health sector. You can see in this slide the members represented: hospital, clinicians, payers, healthcare distributors, device pharmaceutical companies, education, academia, and the federal government. And so we have focused our work in 4 areas. As you see, next slide, please. Okay, so first, public-private partnership. I've listed here some of the members, and you can quickly see the amazing members that we have. Health systems, education systems, you quickly recognize medical school, nursing school, medical associations. Industry, you quickly recognize some of the major pharma, device, and distribution, supply chain. Government, that includes not only HHS, CMS, but CDC, FDA, the VA, and payers like United Optum that Andrew leads, and the Joint Commission, which is so important that Jonathan Perlin is a member of our collaborator, academia, and of course, nonprofit foundations and others. Next slide. So I was going to tell you how we organize. So we have, in fact, organized a steering committee. Then we have these working groups that focus on how can healthcare supply chain work together to reduce its carbon footprint. How can care delivery work together? How can health professionals look at education, communication? And importantly, how do they actually address some of the issues of financing, create incentive policies and metrics? You're going to hear later from Liz Fowler in the next portion of our meeting, some of her ideas, because she's one of the co-leads. And of course, we create a large network of organizations. So we're working actively in these working groups and together across the working groups. Next slide. So already I've mentioned steering committee. I think I won't have time to go over them, but you can quickly recognize how important this group is, including Don Berwick, Jonathan Perlin, and David Scotton, and many others. So of course, I already mentioned the 4 co-chairs. Next slide. So I mentioned the 4 working groups. So I'm going to quickly tell you what each working group is trying to do and how we bring it all together. Next slide. First is healthcare delivery. Well, in what we do every day, we actually take care of patients and do really, I think, a really good job with compassion, with commitment. And of course, we want to make sure as we're doing this, we have a sustainable, quality and equitable healthcare organizations that include the practice of reducing carbon footprint and also reducing unnecessary healthcare services. The challenge of this group is, of course, the need to make changes. Therefore, the kind of challenges in the middle of all the things that's going on. So therefore, it's really important to make a clear case that this is important, both financially as well as for our patients. But also, there's no good way of measuring this together. So we need to begin to say consistently to measure emission reporting together. So the areas of focus of this group is to build a multifaceted case for decarbonization, particularly for the organization leadership, so they can invest and work on this, to agree on sustainable set of metrics, to measure together, to look at best practice, learn from each other. What are the playbooks? And to highlight the policy regulatory changes and solutions. You may hear from Jonathan Perlin, for example, from Joint Commission point of view later on. Next slide. The second group is about education and communication. Here, we really want to empower health workers and learners to advocate for decarbonization, but also to send a message about how important it is on looking at climate change and health. And so they are looking at what are the gaps in curriculum, in education, in the knowledge of climate and health, how to fill this gap, how to support healthcare decarbonization as a greater important part of healthcare education, how to standardize and scale the curricular education programs, help professionals, and then look for opportunities, look across undergraduate education, graduate medical education, and continuing medical education. Next slide. Supply chain, really important because they are generating about 70% of the emissions. And of course, they are very important to healthcare. So the question about supply chain, pharma, device manufacturing, transportation, and the distribution is to look at opportunities to reduce the carbon footprint together and to strengthen its resilience. So therefore, looking at innovation services, product management, manufacturing, packaging, distribution. So their area of focus, as no surprise, is to scale resource and best practices, to highlight policy and regulatory challenges, and how to actually align them, to have them go forward with the changes, and to measure and report how to get standards. Next slide. And the final group is policy financing and metrics, where they're re-looking at, to do this, we need to help all organizations to be able to move forward. So what are the policies needed? What are the regulations needed? More importantly, how to incentivize and create payment structures to support, actually accelerate healthcare sector decarbonization resilience. So they're working hard in creating an integrated, cohesive policy and regulatory agenda, look at barriers and opportunities, identifying what kind of financing incentives and pathways support decarbonization, and to look at implementation metrics for decarbonization. Next slide. So where we are, well, we've been busy. I can tell you for sure that in fact, since September 2021, we have obviously, as I said, created the 4 working groups, start working on them. The whole collaborator are aligned to say, we support the idea of reaching 50% reduction by 2030 and net zero by 2050. We'll work with the Office of Climate and Health Equity and the White House and HHS to support them in the Climate Pledge Initiative, which went very well, and they are reopening this at this point to get more people to sign up. We mobilized membership. We have now over 70 members across health sector and 60 network organizations. And believe me, every day people want to join this, and I hope all of you will join. We have collaborative members themselves taking action. For example, Andrew Witty, leading the UnitedHealth group, is today making a paperless organization. The HA, the AMA, and WMC are all having this in their strategic plan for their association and for their membership. We're laying down the foundation for system change because all systems have to come together and not individually to achieve decarbonization and therefore coordination, alignment, and information. Next slide. I'm going to quickly tell you what they've done so far, and this will only take a minute. First of all, in the first phase, that is in this first 2 years, the healthcare delivery really wanted to make the case for decarbonization so that all hospitals, healthcare organizations are going to do this. They want to look at the barriers, they want to look at metrics, and they want to look at playbooks. So that's what they've done. They are writing a paper for building the case, and this paper is going to come out very shortly. They are featuring stories we've done in modern healthcare and many others, health leaders meeting at the American Hospital Association just last weekend, the major leaders coming together to talk about how they can work on this, and of course, a whole bunch of actions. The professional education also want to understand the gaps, as I told you, and identify opportunities. So their products are looking at focus groups, look at meetings, and begin to look at primer for decarbonization for education. Next slide. The policy finance metrics are looking at how to advance these issues. So they're creating a thing called carbon accounting clinics. For those who want to understand how to do this, we have held several of these clinics for anybody who wants to join and understand this. We look at papers to understand policy regulation, and of course, really important, looking at financing mechanisms. Hopefully we come up with some really good mechanism to support people doing this. And finally, supply chain infrastructure are really looking to collate and scale the resources and look at policy and challenges and foster around metrics. So they've done some really amazing stuff like climate journey map and resource repository for everybody who say, I want to in this journey. Now let's understand this. And they're doing all series of case studies. Lots of progress. Next slide. They have not been idle. Looking forward, we want to build capacity to meet decarbonizing goals, to really further bring together the resources, best practices. And by the way, you all and the network can look at a website and look at what's going on, and anytime help us and tell us what we can do. Playbooks to support emission inventory accounting reporting and share progress and achievement. Voluntary reports for those who are ready to see where we are, how we're moving. And certainly we have work products and plans for communication, mobilize, engage other sectors. We are now forming partnership with IHI, with Kaiser, Healthcare Without Harm, and the initiative in UK called Sustainable Manufacturing Initiative, a marketing initiative where they're putting a lot of effort into it. And we're looking with all of you. And we are going to work on the next phase from 2024 to 2026. Next slide. I think that's my last slide. So thank you very much. We have not been idle, and I thank everybody for working so hard. I turn it back to Andrew and George.
Victor, thanks so much. Fantastic update. Very much appreciate that. And so everybody, we're moving into a phase now of a number of speakers, one after another. We're going to go through pretty quickly in the interest of time, and then have some Q&A toward the end of that as a group, if that's okay with everybody. So without further delay, what I'd love to do is introduce Pam Cheng as our first speaker. Pam is the Executive Vice President of Global Operations and IT and Chief Sustainability Officer at AstraZeneca. As you all know, AstraZeneca is one of the most important innovative pharmaceutical companies in the world, pretty much present everywhere, and has been a real leader in innovation, particularly in the oncology space over the last 10 years or so. So, Pam, I wonder whether or not you could give us maybe a 5-minute sense of how you see this issue from such an important position in the supply chain, Pam.
Absolutely. Thank you, Andrew. Hi, everyone. It's great to be here today. And really, thank you for the opportunity to share some of the reflections on our sustainability and climate journey at AstraZeneca, as well as how we are working through partnerships to drive impact at scale and help effect sort of system-wide changes for the long term. I think everyone here today is united in the belief that we cannot tackle the enormous change of climate change alone, as Victor just said, and that we must work together for the greater good. Next slide, please. Let me start with how we consider sustainability at AstraZeneca. As a healthcare company, we recognize that the health of people, society, and our planet are deeply interconnected. So we take a holistic and integrated approach to sustainability. And that's why our sustainability strategy has 3 interconnected pillars. The first one being access to healthcare, so health equity. The second one is the environmental protection, the topic of today. And finally, ethics and transparency. Now, on topic of environmental protection, we know that on the one hand, climate change is impacting human health and undermining the capacity of our health systems, which are already under pressure. On the other hand, the health sector contributes to about 5% of the total global greenhouse gas emissions, making the transition to net zero healthcare really critical. So through AstraZeneca's flagship Ambition Zero Carbon program, we are focused on delivering absolute reductions on our path to net zero. We are embedding sustainability across everything we do, from the lab to the patient. And right from running what we call the green labs to designing sustainability into our manufacturing and product design from the beginning, and really pivoting to digital clinical trials as well. We are also focused on how we can treat patients earlier and also outside of the hospital settings to improve patient outcomes and reduce emissions in the patient's care pathway. In addition, we've already planted over 10 million trees since 2020 as part of our AZ Forest commitment to reforestation and biodiversity, recognizing that trees are, acting as the lungs of our health. Next slide, please. So focusing a little bit more on our decarbonization effort, I am super proud of this slide. If you look at the left-hand chart, we've clearly decoupled business growth from absolute emission reduction. Our revenue have grown significantly since 2015, close to 70% if you do the calculations. However, our scope 1 and 2 greenhouse gas emissions have decreased by 59%. So once again, our revenue grown close to 70%, but our emissions has been decreased by 59%. Now, that's not accidental. This obviously was a significant amount of work that contributed to our ability to sort of decouple business growth from the emissions. And I hope that this proves to all sectors out there that this can be done, right? We can have a growing business and at the same time be working sustainably, and it makes good business sense. Now, if you look at the right-hand side, by 2026, this is our bold ambition. We aim to have reduced absolute, so there's no offsets, absolute scope 1 and 2 emissions by 98%, which is one of our science-based targets. To date, we've achieved 59% reduction. And by 2030, we aim to have our entire value chain footprint on the way to science-based net zero. We also recognize that the lion's share of our footprint is actually sits in scope 3, meaning suppliers and partner engagement is super critical. And to help tackle this, we've set the goal for 95% of our key suppliers and partners by spend to have a science-based target by the end of 2025. So we are making solid progress and our efforts continue at pace. Next slide, please. In addition to individual sort of organizational efforts within AstraZeneca, we recognize that collective action is critical to decarbonize the healthcare value chain. We are a proud member of several initiatives which are flexing their shared muscles to accelerate sustainable healthcare delivery. So first, the Sustainable Markets Initiative Health Systems Task Force, or the SMI. This was actually originally convened by King Charles III and is chaired by our CEO, Pascal Soriot. Now, this CEO-level public-private partnership, which includes pharma CEOs, the WHO Director General, leaders from UNICEF, the NHS, and more, they really aim to accelerate the transition to net zero health systems. It focuses on actions in supply chain, patient care pathways, and clinical research. Now, recently, the task force launched a joint minimum supplier standard expectations to drive decarbonization at scale. These include targets for emission reduction, disclosures, recycling, waste and energy, renewable power, and heat and water usage. The ask is more compelling because there's multiple voices within the sector involved and aligned. So we are now working with our top suppliers to implement the targets and really encourage you all to check these out on the SMI website. It's pretty cool. Secondly, the Pharma Manufacturing Forum. This is a group of global heads of manufacturing and supply chain operations like myself. I'm a proud member. As you can see here in the middle, we recently aligned to urge our suppliers and partners to set science-based targets aligned with a 1.5 degree pathway. We believe this will be an impactful call to action among the industry suppliers and contract manufacturers. It's also aligned with the 1.5 degree ask in the SMI supplier targets. And I can tell you, when partners and suppliers out there see initiatives like the SMI and from the Pharma Manufacturing Forum, they act on it. So thirdly, I want to talk about Energize. So this is an initiative aims to bring low carbon energy solutions to pharmaceutical suppliers in Europe and North America. Since its launch, almost 400 leading suppliers have registered and representing over 32 terawatt hours of electricity demand. At COP27, the initiative launched its first power purchase agreement, the PPA, representing 12 companies and 2.4 terawatt hours of electricity demand across Europe and North America. That's equivalent to powering about 2.4 million US homes per year. So Energize will now continue to aggregate electricity demand and provide a financially viable and environmentally impactful route for suppliers to decarbonize. I hope these examples demonstrate that together we are really driving actions at scale, and together we are much more powerful than sort of our individual collective capabilities added together. Now, next slide, please. This is my last slide. I think we can all agree that reducing emissions is a moral imperative for all stakeholders across the healthcare sector who aim to improve human health, because the health of the planet is linked to people's health. We know this. We need to come together for our kids and our grandkids, as Victor said, for their well-being. As a business leader, a mom, and a member of society, I firmly believe this is the right thing to do on all levels. Thank you for listening. Once again, thank you for the opportunity to speak and to be here today. Back to you.
Thanks so much for that. Really inspiring on a couple of fronts, really. I think the most important thing you laid out there was a real encouragement that it's entirely possible to help the climate and continue to be a highly successful company. So your point around delinkage of emissions from business performance is super important. And then the way in which you and your colleagues have leaned into multiple different collaborative mechanisms to try and bring the value chain along as one, again, really a thoughtful approach, and applaud you for that. So thank you. Look forward to a bit more conversation later on. But having heard from pharma, let's hear from another really important part of the value chain of healthcare, technology. All the incredible steps forward that have come forward in the last 50 years, which have been transformative in how we all experience healthcare, and to maybe give a perspective from that sector. I'm very happy to be joined by Jeff DiLullo, who is the Chief Region Leader for Philips North America. So Jeff, I wonder if I could maybe hand over to you to similarly take us through your perspective from Philips. Thank you.
Yeah, thanks, Andrew, and thanks for having me. As a purpose-driven health technology company, Philips is committed to improving people's health and well-being through meaningful innovation. That's our core purpose. We aim to improve the lives of 2.5 billion people globally by 2030, including 400 million people in underserved communities. I start with our purpose because it is so critical to how we view sustainability and our important impact we have on decarbonization. Because our purpose is about reaching and improving lives, our ability to lead with a very sustainable ecosystem, we believe actually accelerates us and our ability to achieve our mission. We believe the health tech value chain in innovation specifically, I'm going to talk about that quite a bit, plays a big role in making more accessible, inclusive, and sustainable healthcare available to more people. Now, you already know many of the problems, so I won't go into that. It's an inefficient sector. The range of issues, Andrew talked about lack of standardization being an issue, ecosystem of culture change needed, measurement standardization we'll talk about later during this panel, and target-based sustainability regulation and sufficient incentives. All are things that are sort of formative, but not really creating that critical mass yet. However, we do see a lot of momentum. We believe a long-term fallout actually from the pandemic, and we've seen it in our interactions with hospitals. The pandemic actually has accelerated the desire to find more sustainable path forward across the entire sector. There's additional pressure on cost, need for more remote care capability, staffing impact, and limited people. All of this has changed the calculus in how we pursue more carbon-friendly and sustainable ways of delivering care. So our hospital partners are increasingly looking upstream to us. We sit in the value chain to the supply base to improve that quality of care. And the digital enablers now that are getting to be that tipping point are now kind of the new thing. So I'll talk a little bit about this in terms of the scopes from a hospital perspective, the way we're working on it to support the hospital and the care ecosystem that we supply. Scope 1 in hospital operations, transportation. If we can reduce staff driving around, if we can reduce the amount of gas or helium being emitted in the ecosystem, we're actually helping hospitals. In Scope 2, generating production and distribution of energy. If we can make more energy efficient designed equipment, lower power draw, those things have large implications for hospital operations. And Scope 3, a whopping 71%, as Dr. Dzau stated, indirect emissions in the supply base. And that's where we take it quite personally. It's important to speak about our credibility when we go here. And I love the dialogue with AstraZeneca we just had, because the leading by example is an important piece of every hospital interaction that we have. Leading the way is sort of showing that we've established our own operations efficiency, our own operations sustainability targets, validated science-based targets. By 2020, we were able to achieve carbon neutral operations within all of Philips, 100% electricity from renewable sources, 90% of our operational waste recycled. Operational waste is recycled, and in a med tech world where there's an awful lot of manufacturing, we've been an advocate. We're the first company to sign the administration's Health and Human Services Climate Pledge, reaching zero-based landfill for manufacturing sites by 2020 as well. I'm not citing this to be a resume. I'm citing it to say we believe we have to lead with credibility. It's personal to us. It's part of our mission, so it's very easy for us to walk that road. We're going further, though, because we think sustainability in our business model, as well as innovation engine, really is what we can tip the balance in the entire sector. So 25% by 2025 of our revenue will be from circular solutions, 17% today, but we're well on the way. And eco-design, something we're quite proud of, but also, I think, important in terms of our innovation engine. 70% of our products today have an eco-design science-based validated target or science-based validated carbon reduction as part of what we design. Now, as a supplier for hospitals all over the world, that eco-design is an essential piece for us, because 60% of products, the environmental impact on products or med devices is determined at the design stage. So if we're not designing it in, it doesn't happen. So we take design for sustainability as a main approach for us, and we contemplate the total life cycle use and the circularity potential as part of the design phase. It's actually quite easy to do it once you commit to doing it. So we look end to end at that environmental impact. We also see economic incentives as well. I'll give you just a couple examples. Our Blue Seal magnet, we brought the first 1.5T fully sealed magnet to market. Now, many of you know here today about the cost and the scarcity of helium. Our Blue Seal magnet requires 7 liters of helium versus 1,500 in a conventional magnet, with no need to refill during the product life cycle, which is a significant cost and risk to uptime. It also provides lower power draw as well. We're doing a study right now with a academic research hospital on the total economic value of a Blue Seal magnet not only to the environment, is measurable environment in terms of helium, but also the total power draw and carbon footprint over the life cycle. So that kind of total economic value matters. It actually has a significant impact to the bottom line as well. So it's actually a no-brainer. We're also embedding some sustainable innovation and energy efficiencies in new business models like digital and circularity specific programs. These things became urgent during the pandemic, and we've seen a massive uptick in the desire and the ability to deliver digital solutions. In our circularity universe, our carbon footprint of a refurbished MRI is half of a new one. That also gives us entry point to secondary markets to increase access to care for parts of the world that wouldn't have access to an MR at a lower cost point. And then additionally, some AI like smart speed technologies, things that we can do to improve the quality of the imaging and the speed of the imaging actually reduces power consumption by almost 50% while significantly decreasing scan times, which again increases the ability to see more patients, deliver better care at a lower total operating cost, all because of eco-design. So I'd say this, to do all of this at scale, it's not just about one provider, one med tech company. It is really a coalition of the willing, and that's why I love this forum. To be able to drive decarbonization across the sector, the whole supply chain has to embrace. Adopting a circular mindset would be the first thing. I think this is a willpower item for many. If you think about the joint ability to decarbonize and increase access to care from a supplier standpoint, this is a very easy cultural step, but it does take willpower. Thinking about the total life cycle. For example, our circularity group at Philips harvests and recycles more than 1,600 large, big iron MRI CT systems a year. We take 2 million pounds of metal out of landfills by putting those parts back into good use, either through secondary markets, extending life cycles through harvesting components, or responsible repurposing. The whole industry can do that. Second is standards. We'll talk about it more later, but collectively, we want to encourage the public sector to help clear standards and guidance that can inform and guide action around sustainability. We do this by setting very ambitious ESG targets, but industry standards will be required if we want to scale, and that's a place public and private sector, this forum, and many others are beginning to partner much more. And third, because we're innovators at heart, collaborative innovation around smart digital solutions. I think this is the next ground. We have a huge digital enabler here. We are at a tipping point with technology, largely induced because of the pandemic, to accelerate a lot of the innovation. But it's a shift from resource-intensive clinical facilities to networked and lower-cost digitally enabled settings closer to or at home. So the need is driving the technology innovation, which is going to drive a much more sustainable footprint. Our relationship with the Veterans Health Administration is a perfect example where public and private sectors are doing incredibly innovative things together to solve problems, to deliver healthcare in a more remote care setting. Cloud-based patient flow and managing of telehealth, remote patient monitoring, all of these incubative capabilities are now becoming about at scale. So now the key is to integrate into smarter connected solutions that are interoperable, that allow us to deliver these things across the larger enterprise and hospital ecosystems, all of which removes a carbon signature. So I'll close with this. When I turn it back over to Andrew, I just want to close by saying sustainability, a lot of times we're thinking about it in terms of what it is and how I have to fix what has been done, or looking backward maybe on remediation. With the pandemic, we really feel it has forced us to accelerate innovation into the new, to deliver care in new ways, new business models. We're actually nearing that technology tipping point I keep talking about, because we're able to harness it and deliver it in an interoperable way. So for us, it's much less important about where any one company is on that journey. It's critical, though, that we come together as an industry across the entire value chain to explore digital capabilities, that zero footprint in an interoperable way. And that's the big win for forums like this and for our teams as we go into the future. So thank you, Andrew. Back to you.
Jeff, thank you very much. That's fantastic. And particularly, I think your focus on circularity, I think, is particularly relevant and important, especially in your part of the sector. But I got to say, having just listened to both you and Pam, as somebody who, I'm in the delivery end of healthcare and the payment end of the healthcare value chain. And very often the thing that keeps us up at night is worrying about the scope 3. Obviously, you and others in your part of the system are there. So to hear the focus that you've got in this and the progress you're making is very important. And I think it's, again, demonstrating to many others the art of the possible. So really applaud you and your colleagues for the work you're doing. And we appreciate very much your engagement here as well. So thank you so much, Jeff. Having heard from the private sector, why don't we flip to government? And I'm delighted that we're joined by Liz Fowler, who's the director of CMMI. Just to state the obvious, the government is really oftentimes the rule maker for how this complex marketplace really operates. And in Liz's role, she has a very unique perspective, I think, on how incentives in particular can influence the behavior of this marketplace. Would love to hear your perspective, Liz, from, I know you've been involved very heavily with the collaborative, but love to get your perspective on how you see things at this point, Liz.
Well, thank you so much for this opportunity to be here today. I really am grateful for Dr. Dzau and the NAM's leadership on this issue. And it's also been great to be part of the Decarbonization Collaborative. I'm excited to share more about the progress that HHS has made in decarbonizing our healthcare system. And also, I've learned so much already from my co-panelists about their organization's efforts to tackle the climate crisis. As Dr. Dzau so effectively articulated, the negative impacts of climate change have already arrived. According to 200 medical journals, climate change is the most significant threat to human health in the 21st century. And the World Health Organization projects that between 2030 and 2050, climate change is expected to cause about 250,000 additional deaths each year from malnutrition, malaria, diarrhea, and heat stress alone. It's clear that we must act now, and we can't do it alone. The threat of climate change requires all of us across healthcare and beyond, public and private, to partner in our efforts to mitigate and reduce the impacts of climate change. President Biden set a bold target of reducing U.S. greenhouse gas emissions to 50 to 52% below 2005 levels by 2030 and achieving a net zero emissions economy by 2050. And the Biden-Harris administration has mobilized a whole of government approach to confront the climate crisis by integrating climate readiness across every agency's mission and programs. Since the start of this administration, HHS has made tremendous progress in protecting people living in the U.S. from the growing health threat of climate change by reducing greenhouse gas emissions and strengthening climate resiliency. This includes creating 2 new offices in the department, the Office of Climate Change and Health Equity and the Office of Environmental Justice, establishing an HHS-wide climate change and health equity working group, and prioritizing cross-government collaboration. And in April 2022, HHS launched a pledge initiative to mobilize the healthcare sector to reduce emissions. Signing organizations agreed to cut their greenhouse gas emissions by 50% by 2030 and achieve net zero emissions by 2050, in accordance with the pledge. 1 year later, I'm pleased to report that 116 organizations representing 872 hospitals have signed on. The pledge is still open. Health sector groups are encouraged to sign the pledge and join the growing movement to build a healthier, more resilient future. And to support signatories in their efforts, the Office of Climate Change and Health Equity recently released the Quick Finder for leveraging the Inflation Reduction Act for the health sector, which identifies and explains how the health sector can use resources, incentives, and programs included in the IRA to advance climate action. And many of these investments have the potential to improve care, increase preparedness, and reduce costs through investments in renewable energy, including building efficient and resilient infrastructure that can better handle climate-related threats to operations. Turning now to CMS, where I sit. At CMS, we recognize that decarbonizing the health system and mitigating negative impacts of climate change requires innovative approaches to healthcare payment and delivery. And that's why CMS has taken action to provide flexibility to states and healthcare facilities as they respond to climate change. Last month, CMS issued a waiver permitting healthcare facilities to utilize a microgrid system, such as an alternative source of energy. This waiver may make it more appealing for an organization to apply for IRA funds and advance efforts to decarbonize their healthcare system. Additionally, CMS cleared the way for Oregon to test groundbreaking climate initiatives in the state's Medicaid program. Starting in 2024, Oregon will cover payment for devices such as air conditioners and air filters for Medicaid members with health conditions who live in an area where an emergency due to extreme weather has been declared by the federal government or the governor's office, according to the Oregon Health Authority. The Oregon initiative reflects what we're trying to do at the CMS Innovation Center, which is where I currently serve as director. The CMS Innovation Center's renewed vision is to create a health system that achieves equitable outcomes through high quality, affordable, person-centered care. And we recognize that the impacts of climate change disproportionately affect the health and well-being of underserved communities. These communities have increased exposure and vulnerability to climate change and its health impacts, given that the environments where they live in already are associated with poor health outcomes. And this undermines the ability of underserved communities to build climate resilience. In response, the Innovation Center has been thinking about ways to leverage our models to support communities, embedding solutions to advance health equity. And many of these efforts to promote health equity rely on climate and environmental solutions. As an example, while the Medicare Advantage value-based insurance design or VBID model does not focus on mitigation, it has adopted policies to promote resilience to climate change and extreme heat. Starting in 2025, Medicare Advantage organizations participating in the VBID model will be required to offer supplemental benefits in at least two of three health-related social needs areas: food, transportation, housing insecurity, and living environment. And we view this last bucket, living environment and housing security, as giving the model and its participants greater flexibility on environmental health and climate change supports in the future. So I'll close by recognizing that there's much more to do. And going forward, we plan to prioritize more external commitments, reporting, and support. And at the CMS Innovation Center, we're exploring how to weave this work into the fabric of payment and healthcare delivery. So I'll stop there. Thank you again for the opportunity to join you today, and turning it back over to Andrew.
Liz, thank you so much. Great. And I really appreciate all the leadership that you personally and your colleagues at CMS and CMMI have been deploying in this space, as well as more broadly across the whole health system. That I think the degree of innovation that you bring to try new models, to tweak the system, to improve relentlessly is something that many countries worldwide, I'm sure, admire, and appreciate very much your perspective today that you shared. Look forward to picking up maybe a little bit later on that as well. I'm going to move now to Jonathan Perlin, who's the President and CEO of the Joint Commission. As you know, an incredibly august organization founded back in 1951, really an organization that many rely on for authentication, essentially, and validation. And I look forward very much to hear from Jonathan, his perspective on the topic of decarbonization. Jonathan, over to you.
Well, thank you so much, Andrew. And let me begin by really thanking your leadership, that of George Barrett, Admiral Levine, and Dr. Dzau, who I think set the stage so perfectly in the United States by virtue of our carbon footprint domestically and the healthcare carbon footprint we emit globally. We don't just have the moral right, we have the moral obligation, as this is not just a matter of social justice, it is a matter of health and health equity, and that's why the Joint Commission is interested in this. So if we go to the first slide, I want to tell you a little bit about what we've been doing. We actually convened 2 technical advisory panels this past year. One actually convened some of our strongest critics, including a member of the collaborative, Jody Sherman, a professor from Yale. And they had identified that even though the Joint Commission standards did not say use single-use items, et cetera, one could construe, but there may be implications that drove excess consumption. So we asked that panel to scrub our standards to be sure there was nothing that inadvertently led to excess consumption. So that's what we've done in terms of taking our own medicine first. The second is that a second technical advisory panel was convened, and they helped us generate standards to accelerate healthcare organizations' efforts in both carbon accounting and ultimately decarbonization. So let me share with you the draft standards, which are out for review. And next slide, please. I will tell you, that I've been surprised that they've not been met with a terribly warm reception. We don't think they're terribly high bar, and let's go through them. And I would hope that one might judge for themselves. The first element of performance, a requirement of a standard, is that hospital leaders designate an individual responsible for oversight of activities to reduce greenhouse gas emissions in coordination with clinical and facility representatives. To be really clear, this doesn't say hire someone else. What the implication is really is that someone who's on the leadership team be designated as the individual with oversight for the carbon accounting and consideration of carbon in the three scopes of activity: the stuff we do directly as part of healthcare, the energy that we consume in our vehicles, our facilities, and the water we consume, and in the third scope, the products we buy, where there's just huge opportunity. Let's go to the next slide, please, and look at the second of four elements of performance. This has to do with the hospital's decrease in greenhouse gas emissions and waste. And it asks that the hospital measure three or more of the following: energy use, purchased energy, anesthetic gas use, pressured meter dose inhaler use, fleet vehicle gasoline consumption, solid waste disposal to landfills or through incineration. You know, the irony here is that this is not difficult carbon accounting. We, having been on the provider side, receive bills that quantify the amount of energy that's used. We understand the amount of anesthetic gas we use or the number of inhalers that we prescribe. And the irony to my ear is that many of these things, if we do better, we actually save money. I believe Kaiser Permanente and the National Health Service have demonstrated effectively cost savings when anesthesia practices are changed. And changing from meter dose to dry powdered inhalers is something that should be fairly straightforward for a health system to accelerate. You know, we do have the opportunity in terms of the solid waste, and just love my previous panelists' comments about circularity in the supply chain. Let's go to the next slide, please. The third of four elements of performance is about the hospital decreasing greenhouse gas emissions and waste by developing written goals and action plans to reduce greenhouse gas emissions in three or more areas that they've measured. So the first begins to account this in the last element of performance, and this is simply identifying a plan to begin to make a change. The final element of performance on the next slide has to do, next slide please, with at least annually the hospital analyzing its sustainability measures chosen in the second element of performance to determine whether it's meeting its goals, and revising its plan if the measurements and activities in element 3 are not achieved or sustained. So these were really meant to be introductory standards. They were meant to assist organizations in beginning to quantify much of the information that they already have. Next slide, please. They were put out for public review, and I wish I could tell you that the review was enthusiastic, but there is reason for optimism within the feedback. So let me tell you what that is. The negative feedback has predominantly come from senior administrators who report that they're simply overwhelmed by workforce shortages, financial challenges, and the challenges of patient care in a changed environment. On the other hand, younger clinicians, and here I'm using younger than 45 as the measure there, are asking for sustainability standards. As someone who's been on the receiving side of accreditations, it's rare to ask for standards. There are two areas that our colleagues are asking for standards here in environmental sustainability and health equity. So this is a perfect convergence because, as Dr. Dzau so well described, this is an issue of both health and health equity. We had the opportunity to review some of the feedback and the standards with policy, finance, and metrics. Next slide, please. You also felt these were good introductory standards. But because of the turbulence that has been articulated here, we're going to launch these initially as extra credit. They won't be determinative of an accreditation decision. And the timeline is still a little bit up in the air. We usually we do leave 6 months between publication and implementation. But you know, this is the irony of the impact of healthcare on the climate. all of us who came to healthcare, whether administrative or clinical, came with a desire to help others, be it the individual patient or improve health globally. And here, as an untoward and completely inadvertent side effect of our work, we're violating the first principle: do no harm. We're doing harm. And so our moral obligation here is to make a change. And I hope those of you, not only who are part of the collaborative, but those of you who are watching, will really look further into the information you're receiving and raise your voice to really exert your influence and wanting to help us in healthcare abide by that first principle of doing no harm and leaving the world better, not only for us, but for our children and our children's children. Andrew, thanks so much. Thanks so much to the NAM Collaborative.
John, thank you very much. And thanks for being so direct. And I thought that was a very thought-provoking set of comments. And I also just want to applaud you and the Joint Commission for really creating a kind of dialogue which feels much more accessible than the normal, incredibly difficult to understand carbon calculations that we all oftentimes have to try and deal with. I think the efforts you've taken to try and bring this into everyday kind of measurement fields, which we all see, recognize, and can spot, that's a real value. And I hope some of that pushback you're receiving over time can recede as people prioritize, obviously, and maybe one of the areas we all need to think through is how can we just make it easier for people to do those basic measurements.
Andrew, if I might, this is a perfect time to put a plug in for the National Academy of Medicine's 3 carbon clinics, because carbon accounting is difficult. And by the way, the 20% of providers who are part of SEC regulated public companies are obligated to begin reporting. And so the National Academy of Medicine sponsored 3 carbon clinics, and I believe that the team can provide links so that colleagues who are unsure of the more difficult carbon accounting can help to become more educated and facile with what is a bit of a difficult area. Thanks.
No, totally agree. Great reminder. And yes, absolutely, everybody, that's those clinics are available. And you can get to them through the links at NAM and through the collaborative. John, thank you very much again. I thought it was an excellent, thought-provoking set of comments. We're coming to the last of our speakers right now, Ali Santori, who is Executive Vice President and Chief Advocacy and Social Responsibility Officer at Providence, one of the largest healthcare provider organizations. Any of you who are on the West Coast, I'm sure, will be incredibly familiar with Providence. Looking forward very much to hearing from a perspective of the provider side of this value chain of the environment we've been discussing this morning. Maybe, Ali, with that, I could hand over to you to finish out the sessions. Thank you.
Thank you, Andrew, and thank you, Dr. Dzau and our co-chairs, and thank you to Liz and CMS for their leadership and John at the Joint Commission. And I will stand up and say, we are a provider that is not pushing back on the Joint Commission proposal. We provide full support to that proposal. So we will help lead the way and talk through how we are living up to those standards, because we've set internal standards at Providence for both health equity and environmental stewardship. And so hope to provide a little bit of a roadmap to show how we've gotten there and how others can join in. Next slide, please. So just to give, Andrew mentioned, we're highly West Coast concentrated, but to give a quick overview of the scope of Providence. So we operate across 7 Western states. We are one of the largest organizations in the country, founded by a group of women 165 years ago. And our history and ministry of our mission on the West Coast runs very deep. So for example, our corporate tax ID in Washington state is 2. So the railroads beat us, but we have been in those communities offering care and support for over 165 years. Along with the statistics that you see here, we also operate over 40 million square feet of real estate that is incredibly carbon intensive, and that much of which has to operate 24/7, that we can't power down. But next slide, please. But we are driven to this work and our commitment to environmental stewardship through our mission to care for the poor and vulnerable, and our value of justice, which specifically calls out that we strive to care wisely for our people, our resources, and our earth. So that sign, that value of justice, hangs in every one of our hospitals and one of our clinics that reminds our caregivers, our patients, and our communities that we work on this effort aligned with our mission and our value of justice. And as has been mentioned many times by my panelists before me, that we believe that this work is inextricably tied to health equity. We see the impacts of climate change in our patient population. We see it on the impacts on our facilities. So in the 7 states that we're in, Providence is sort of a microcosm for the United States because we operate in some of the most rural communities in West Texas, Kodiak, Alaska, to LA County. So we have seen extreme heat in Texas. Extreme cold in Texas. We've seen extreme heat up and down the West Coast. We have seen fires up and down the West Coast. So we see the real-time impact, and we realize, as has been mentioned, that we are part of the problem in healthcare. You know, we're called to do no harm, yet the carbon intensity of our operations is causing increased health impacts on our patients and our communities. So we believe that we have a moral responsibility, a moral obligation to pursue this work with vigor. Next slide, please. And this is just a brief history of our environmental stewardship journey. I won't go through this, but I want to call out a couple key dates. We established a chief environmental officer in 2016 to lead this work. Dr. Beth Cheng, who some of you may know, she's absolutely incredible and really the drumbeat behind this work across our organization. And in 2020, on Earth Day 2020, in the middle of the pandemic, we announced our goal to become carbon negative across all 3 scopes. And, you know, nonprofit healthcare, Providence, is still reeling from the pandemic. We are still experiencing those significant workforce challenges and other challenges leading into 3 years post the start of the pandemic. But we believe that this work cannot be a nice to have. It cannot be a side hustle. It needs to be something that is ingrained and integrated into our business and strategic operations. So we face all of the similar challenges that our provider colleagues face, but this work is not only a business imperative, it's a moral imperative. Next slide, please. So I mentioned we're addressing all 3 scopes in order to become carbon negative by 2030. We believe that these scopes account for about 95% of our emissions. And I'm very grateful for the tremendous work that Philips and others are doing around the supply chain, because over 50% of our emissions come from the supply chain. So that integrated partnership across healthcare delivery and the supply chain is critical to getting this work done. Next slide, please. So this is a visual overview of our strategic plan that I won't go through, but the key takeaway here is that this takes all of us working together. So every part of our system is engaged in this work. As I said, we've integrated it into our strategic operations, into our financial strategic planning. And then one of the key elements as well is leader accountability. One of the things that we've done is we've tied our executive compensation to 3 goals. The first is around health equity and reducing health disparities across our footprint. The second is our environmental stewardship goal and reducing our carbon emissions across these 3 scopes year over year. And the third is diversity, equity, and inclusion. So by having these accountability levers, we're really able to put our money where our mouth is and show that this work is not just something that we're going to hang on the wall, this goal that we have, but it's something that everyone across the organization is being called to do and called to engage in. Next slide, please. So this is the strategic framework that we use to communicate our efforts across the system. It's a mnemonic that gives an overview of the 5 buckets that we're tackling and work streams within those buckets. We act, but it's also a call to action, because as we've heard today, that we can't do this work alone. And we need our communities, our government, and every caregiver across Providence working towards our goal to become carbon negative by 2030. So the 5 buckets of we act are waste, energy and water, agriculture and food, chemicals, and transportation. And we have specific goals associated with each of these buckets of work that will help us along our journey. Next slide, please. And looking forward, Jeff, I may have to arm wrestle you because I believe that we were the first to sign the HHS pledge, but we can defer to Admiral Levine and Liz to settle that up. But we are focused on part of that pledge for 2023 is the creation of a climate resiliency plan. And we have designed our climate resiliency plan to supplement our We Act carbon mitigation framework. And it's called We Reach for resiliency, equity, adaptation, climate, and health. So that is our focus for 2023, is completing that plan. As I mentioned in the beginning, we have seen the real-time impacts of extreme weather on our patient populations and on our facilities. And I really appreciated Liz calling out the work that was done in Oregon. And we worked with Senator Wyden on the provisioning of air conditioners and cooling units for vulnerable populations when the West Coast experienced such radical heat waves. And we're really happy that that's going to be scaling out eventually across the country. So for our resiliency plan, it's going to focus on infrastructure. So shoring up our infrastructure so that we can continue to provide continuity of care in the face of these continued extreme weather events. Clinical outreach and education, and then community health education and investment to ensure that we're not only shoring up our facilities, but also our communities, and that we're ensuring that our most vulnerable patients, we actually have a program within EPIC called Community Pathways to Health, where we are able to identify those most vulnerable to extreme weather events, those who have chronic lung conditions, respiratory conditions, and don't have access to transportation to a cooling center in the case of extreme heat. And we can actually go and identify them by zip code and provide these sort of cooling units or take them to a cooling center ourselves. So that's all part of our climate resiliency work that is being spurred on by the HHS pledge. So we're really grateful for the Biden administration's leadership in this space, and we're all in when it comes to that work for 2023. Next slide, please. So a recap of where we've come since we set our goal in 2020. So we've reduced our carbon emissions across all three scopes by 13%. We have 24 Providence facilities, including our system headquarters in Redmond, Washington, operating on 100% renewable energy. And we have done significant work, much like Kaiser in the anesthetic gas space. And so we've reduced the carbon emissions from our anesthetic gas by 70%, with a savings of $3.5 million annually. We've done all this through data. So we have designed and developed a We Act scorecard that tracks real-time emissions within those 5 buckets that I outlined that are part of the We Act framework. And they are able to help our leaders see where they are in real time and how they are meeting our, how they're doing in meeting our goal. We also harness a little friendly competition to make sure that all of our regions across Providence are in line with where we need to be on behalf of our communities and our patients in getting this work right. Next slide, please. And this statement emerged from our strategic planning process. Our vision at Providence is health for a better world. And so this statement really beautifully encapsulates our commitment to this work and why we do it. And we believe, as I said at the beginning, that this is a moral imperative, it's a business imperative, and we can't afford not to do this work. So thank you.
Ali, thank you so much. Excellent example really of leadership, but also then how you've created a mobilizing framework for all of your employees and colleagues to get behind. And those examples you just laid out of how you're mobilizing the organization, quite inspiring. I think for anybody who's running a very big it's always hard to think about how do you get people over the horizon to kind of march to the same drumbeat. And I think those examples, the way you're doing it at Providence, is a fantastic showcase of how it can be done. So appreciate that very much. Listen, we've got maybe 7-8 minutes left just for some brief further interaction. Maybe so. Unfortunately, we won't be able to have too much, but let me just kick things off a little bit. Pam, could I just ping back to you? Could you just, what are you seeing from the kind of R&D field of what, maybe give us a bit of inspiration for what might be coming in the next decade in terms of R&D innovations which could step down the carbon intensity of the pharma sector? Just be intrigued if you've got any 1 or 2 thoughts there.
Yeah, so let me go quick. I know we are short on time. Thank you for the question, Andrew. Let me touch on 2 things, which is labs, the emissions from our labs, and number 2 is the clinical programs, right? So clinical trials, if you will. So if you look at, our aim is to really design out waste and design in efficiency to ultimately run and operate our sites and our labs and our experiments in a more sustainable way. So important because lab uses about 5 to 10 times more energy per square foot than normal offices. So significantly cutting emissions from our labs is really critical. So in 2020, we received our actually very first My Green Lab certification based on improvements to how we operate. And we now have 11 certified labs in our network. So this cuts across the R&D space, research development, and actually commercial manufacturing. So really sort of declaring that war on emissions in our labs. So we're doing that. The other one pretty intriguing is really around our research programs. We did an interesting exercise recently where we reviewed close to 100 protocols and data that we've collected across all of our therapeutic areas. And we found that 70% of that data could be collected in patients' homes with clinically validated devices. So instead of patients who are on clinical trials having to get to a clinic, to a hospital, whatever the case may be, to be able for the program to collect data, we can actually, through digital technology, and devices, we can actually collect 70% of that from patients' homes. So think about that in terms of a huge areas of opportunity to be more patient-centric and eco-friendly in the ways we run our research programs.
No, two great examples, Pam. Fantastic. Really appreciate that. Let me go to the other end then. So Liz, I mean, a little bit similar question, your territory, as you're thinking about you mentioned a couple of examples of new incentives around or freedoms around things like microgrids. If you were going to just speculate over the next 4 or 5 years, Liz, what might be next on the agenda as you think forward in terms of evolution of the perspective from CMS and incentives?
Well, I think we are looking very carefully at where we can play an active role, and at the very least, not stand in the way and provide the flexibility that organizations like Allie's and Pam and Jeff all need from us to be able to do what they believe is the right thing. And Allie, I loved your comment about this not being a side hustle, and this is really central to what you're doing. So I think what we learned during the COVID pandemic is that the agency can be a good partner, that we can be as flexible as we need to be when the job needs to get done. And I think we're looking for those opportunities actively. Just as another example, and I mentioned the Innovation Center's work around Medicare Advantage VBID model, and really we were targeting these benefits using the Area Deprivation Index, which is a geographic measure of need. And I think we are looking at other factors and how to consider, for example, environmental health justice and climate resilience as we think about those areas to target and maybe to incorporate into some of our models. So I think we're learning as we go along, and at the heart of it, I think the agency wants to be at the table and be a partner to the organizations that are leading here.
No, that's great. Thanks so much, Liz. Ali, let me go to you. You're well advanced in this agenda. I'm sure still a lot to do, but well advanced. There'll be people watching and listening to this who maybe really they're kind of in your world. They really want to start, but they don't know quite what the first step should be. From your perspective, what advice might you give a provider group who wants to get serious about this? What would you encourage them to kind of start with?
Yeah, thanks, Andrew. That's a great question. So I'll say first and foremost, sign the HHS pledge. That's not a paid plug, but I think that for us, we found, we established our goal before the pledge, but we found that commitment really anchored the action. So once we made the commitment to become carbon negative, we had to look out and say, wow, this is going to be a lot of work that's going to take all of us. How do we build a roadmap to do that? But because there are so many competing priorities, if you come at it from should we do this? Should we not? It's going to get sidelined. It's going to become that side hustle. So I think establish a commitment, put a bold goal out there that your system wants to work towards. I think that's number one. I think that comes with engagement from leadership. This has to come from the top. You know, our CEO, Dr. Rod Hochman, is fully engaged in this. Our board of trustees at Providence is fully engaged in tracking our progress on this effort. So leader engagement is absolutely key. And then the next component is data. Start to get a hold of your data. We found that, you know, it's similar to the Medicare program, where a disproportionate amount of spend in the Medicare program is at the end of one's life. Whereas with our facilities, we had a disproportionate amount of facilities that were creating higher carbon emissions. So once we were able to look at our data, we saw that there was some low-hanging fruit that we could approach that would significantly increase our efficiencies, drive down cost, and improve our carbon footprint. So I think that setting a bold goal, getting leadership engagement, starting with data, but not being afraid to start. So you don't have to start big. You know, you can set the goal, but start looking at that low-hanging fruit. We've been able to do this with minimal investment, and we've actually saved money annually. So I think that there's also this concept that those two things are mutually exclusive, you know, investing in sustainability and saving money. So I would do away with that notion and just start.
Which really thank you, and that really echoes Pam's comment right at the beginning in terms of there's a dislocation between performance and carbon output. We have to believe that's achievable, and your example is another good example of that. So John, I was super interested, you know, as you just listened there to Ali talking about you know, some of that advice for people who are just beginning, start to measure. John, do you think there's more that the Joint Commission could do to iterate? You've created, I think, a very practical set of initial standard areas, measurement areas. I wonder, as you were listening to Ali there, does that inspire you to think there's value in having a greater, you know, a little more activity in that space to get a kind of more of a feedback loop going between the providers, Joint Commission, making that thing dynamic? You're probably already doing it, but I'd love to hear your perspective.
No, that's thanks, Andrew. And let me just take a moment to recognize Ali and Rod Hochman and Providence for the terrific leadership, because as our good friend Don Berwick, who with Liz and I chairs the Policy Metrics and Finance, said, the great thing about benchmarks is that they're not theoretical. And too much of the bandwidth is taken up by people who say it can't be done. But with activities like the Inflation Reduction Act, which offer subsidies, there's a positive. Ali gave some fabulous examples of positive returns on investment. And one of the things that we can do at the Joint Commission and are doing is to stand up a resource center. And we'd love to feature those organizations that actually are in the lead in terms of showing how things can be done. I want to take a moment just to thank Liz Feller and CMMI for the microgrid waiver. In terms of things that we can do, we are incorporating that guidance into our standards so that healthcare organizations that have alternatives to the usual fossil fuel driven power plants can have microgrids and capacities to meet their frankly federal mandates for energy reliability in times of emergency. And so we will incorporate those advances as they come forward. But that was a major move very quickly by CMS and CMMI, and it's greatly appreciated. So, you know, to sum it up, I think the areas are to highlight those who are in the lead, create a website along with National Academy of Medicine and others that help people understand the hows, but really, you know, demonstrate through inspiration that one can also integrate environmental responsibility and good business. Thanks.
John, thanks so much. Hey, just maybe final question, observation, really, Jeff, for you. You know, as you're obviously a leader in an enormous global operation with activities in most countries around the world. Just as you think about this agenda, other parts of the world where you would say it would serve us all well to spend a bit of time looking at best practice already achieved? You know, always good not to have to reinvent something that's already been done. Just kind of intrigued about maybe a little bit more of a global perspective in terms of what you see at Philips from other environments.
Yeah, it's actually it's a very interesting question, because I think I've been at Philips about 4 years, and it's the first time I've worked for a European company. And the most immediate thing that stands out to me is Europe in general has figured this out well before we have here in North America. And so I think we're at a very different starting place as a continent, essentially, than Europe. And so the value of that is that we've built good practices, particularly in the supply chain. We've been at this a long time because it came to, I love what Ali said. By the way, Ali, I affirm that Providence, we love working with Providence. I affirm that you guys were number one in the signatory from a med tech provider standpoint, though we did run to the table just behind you. Always let our customers go first. But that is top down. Our chairman of the board, our CEO, it's been very, very top down directed because I think it's much more of a natural mindset in the European leadership team than it has been here. So we've benefited from that. Now we've kind of industrialized that across the globe. So the value of having a global operation for us is that I've taken the culture, exported it here. Now we're creating these circularity environments that are bringing assets from the United States back into other parts of the globe to increase health equity or access to care where you wouldn't normally have it. That's the beauty of the circularity program. If we can do it in South Bay with underserved communities there in San Francisco, or we can do it in North Africa. So we're leveraging that culture. We've built the programs now globally, and we're able to kind of export it because of the maturity of it.
Oh, fantastic. Great. Listen, thanks, everybody. I really want to thank all of our speakers today. Thank Pam, Liz, John, Jeff, and of course, Ali, who rounded things out for us. Really, I thought a really fascinating blend of perspectives from private, public sector, provider, manufacturer, high up in the kind of scope 3 world, right down into the delivery world. People who have really committed themselves to this agenda. Was kind of the binding message for me was leadership. That leadership has to stand up, make this a priority, then start to mobilize measurement, data collection, and then start to. I think what was coming through in all of this was you're all delivering wins. You're all able to then turn around to your stakeholders, your employees, your clinicians, and show real progress. And winners keep winning. And I think all of you gave me the sense of momentum, which is, I hope, very inspiring for people who are maybe looking to jump onto this program of work and this ambition to try and improve the carbon footprint of the healthcare sector. As George said at the beginning, it's a super important agenda. If we don't make progress here, we will end up continuing to damage the environment. We'll end up, as many people have said on this call already, causing harm unconsciously and not intentionally, but it happens nonetheless. And it's our job to try and change that course. So listen, again, thank you to all of the speakers. Appreciate the way in which you've been so clear and prompt during the sessions and for giving up your time today. And with that, I'm going to hand back to George and Victor. Thank you.
Andrew, thank you very much for your moderating this session. Extremely well done. And I want to thank the speakers. You and your organization are exemplars of leadership, as Andrew said. It's a really encouraging and accelerating conversation to know that it can be done. And as Andrew said, you demonstrate the wins. I think the wins is not only achieving the endpoints, the wins in terms of reducing your cost, actually, and get better outcomes. So I want to say to the audience, some 400, 500 of them, join us. Join the HHS pledge. And really, it takes all of us to work at this together. Later on in a closed session to our members, I'm going to discuss more about how we're going to start a real movement campaign around these areas. So thank you very much. Over to you, George.
Thanks, Victor. Let me just add my voice to Andrew's and to Victor's in thanking our panelists. That was fantastic. Pam, Liz, Jeff, Jonathan, Ali. There are some wonderful examples of leadership, which each of you have highlighted. This is about leading by example, and each of you have done that. So we very much appreciate that. I'd like to just express appreciation to our co-chairs, Admiral Levine, who will join us next time, and Andrew and Victor for their leadership, and to everybody who's been part of this collaborative. What you've heard today is how interconnected our work is. One company's, Providence's scope 3 is Philips scope 1 and 2. And that's the very nature of our work. So appreciate that, all of you. And finally, I'd like to express my appreciation to the National Academy staff, whose work is so critical in moving our initiative forward. So Victor, with that, I think we are done with the session, and thank you all.